Good morning. Thank you for coming to today's press conference to provide critical updates on Howard County's response to COVID-19. My name is Angela Cabellon, and I am the Deputy Chief Administrative Officer for Howard County Government. We appreciate you greatly for being here today to help us get our message out to our community. I want to just make a mention that we had a last-minute cancellation of our sign language interpreter. Closed captioning will be available online once the recording is available. Today, you will hear from the following people. Opening remarks and an overview of our new policy will be provided by our County Executive, Calvin Ball. You will then hear critical updates from our Health Department Health Officer, Dr. Rossman. We will also have speakers from Howard County Government, which will speak further into the policy, and that is Raul Delerme, Director of Recreation and Parks, and Jackie Scott, Director of the Department of Community Resources and Services. You will hear our partners' response, and that includes Dr. Michael Martirano, Superintendent of Howard County Public Schools, Dr. Kate Hetherington, the President of Howard Community College, Tonya Akins, CEO of Howard County Libraries, Dr. Shafiq Ahmed, Howard County General Hospital. Other attendees here today who will be available for questions are Chief of Police, Lisa Myers, Acting Fire Chief, Bill Anashevsky, Acting Director of the Office of Emergency Management, Mike Hinson, Larry Chweel, Director of Economic Development Authority, Brandy Gans, Chief Information Officer, Kelly Simino, Director of Housing, Gary Cook, our County Solicitor, Stephen Liggett-Creel, Department of Social Services Director, Amanda Hoff, Director of Tourism, Sheriff Marcus Harris, State's Attorney Rich Gibson, Beta Dayhoff, Director of our Community Action Council. I also welcome our council members, Chair Deb Young from District 4, Vice Chair Liz Walsh from District 1, Council Member Christiana Rigby, District 3, Council Member Opal Jones, District 2, Council Member David Youngman, District 5. I now would like to bring up our County Executive, Dr. Calvin Ball.
Thank you, Angela, and thank you all for being here today. We've gathered county officials and community leaders here to provide updates on the current situation regarding COVID-19 and our response. At this time, there are still no confirmed cases in Howard County. That said, we're still closely monitoring this rapidly evolving situation, and ultimately, we anticipate there will be a confirmed case in Howard County. It's not an if, but a when. We're going to do everything we can to slow the spread of this virus, and we need to change our mindset on what the near future will be like. This is a formidable challenge, and it is critical that we work together as a community, and we work to slow the spread of this virus and to protect all our residents, including the most vulnerable. We must be unified in our approach, and I appreciate the hard work and the focus across all our departments that have been instrumental in making proactive decisions to prioritize public safety. I'd especially like to thank our coronavirus task force. We've held frequent meetings in preparation for this ongoing emergency. As public officials, we prioritize the public safety, health, and welfare of our residents, businesses, and county government employees. And at this time, the most important steps we can take are mitigation measures, which include increased social distancing. As you can see, just here in this room, we're practicing what we preach and keeping distance from one another. We're taking the following steps now to slow the spread of COVID-19. On Tuesday, we canceled out-of-state travel for county employees for the next 45 days. This restriction will be reassessed at the end of that period or should new developments arise. Effective yesterday, the following types of Howard County government events are canceled for the next 45 days. Gatherings, meetings, or events that are likely to attract one of the at-risk or vulnerable populations per the CDC, which include older adults, those with serious chronic medical conditions, communities or groups that commonly travel. All other Howard County government events are being assessed using the following criteria: the ratio of space to attendees to allow for social distancing as described by the CDC, whether the event is likely to attract people from areas where there have been cases of COVID-19, the availability of appropriate hygiene products such as soap and water, hand washing stations, hand sanitizers, and tissues, the ability to meet all current health department and/or CDC standards related to sanitization and food handling practices, and whether the event could be rescheduled or held virtually. For example, we canceled last night's budget hearing, and this morning we announced that we will be hosting a virtual hearing later this month. At this time, non-county government gatherings, meetings, and events held on county property are being evaluated on a continual basis. These policies will be reassessed as appropriate should new developments arise or after the 45-day period. This policy impacts many of our departments, and we will be hearing from our Department of Recreation and Parks and our Department of Community Resources and Services shortly. Additionally, effective Monday, all non-essential county employees who are able to telework will be instructed to do so. We are strongly recommending that organizations and residents who are holding events follow the guidance that I've just outlined. We need your help to protect all of our families, which will include curtailing to the extent possible going out. For many of us, that may mean staying at home more. If your gathering, meeting, or event is in the next 45 days and will attract one of the high-risk populations or attract out-of-state participants, please cancel or reschedule. Our full recommendations for public events are available on the Howard County website. And given these decisions and major updates from the governor and state superintendent yesterday, we recognize that this will be disruptive to our daily routines, but it is necessary. If we put these steps in place early enough, we have the opportunity to slow the spread of COVID-19 and allow our health system to be more prepared. Thank you for your patience and understanding as this is impacting every resident and every family and every business in Howard County. We understand this is a scary time for many of us, our families, and our neighbors. Please continue to be compassionate, considerate, and patient. And now is the time when we choose to be kind to each other and not let fear define our approach. We must remain calm, informed, and vigilant. Thank you.
And now you'll hear from Dr. Rossman, our Howard County's health officer.
Good morning. I'm Dr. Maura Rossman, Health Officer for Howard County Health Department. We are in a dynamic situation, and it is important that our community has the most accurate and up-to-date information to allow them to make the best decisions regarding their families and businesses. Currently, in the state of Maryland, there are 15 cases of COVID-19, with community spread now being seen. As mentioned, we have no confirmed case in Howard County. Although we have no cases, we are preparing for this eventuality. We are focused on prevention, containment, and mitigation. We are in daily communication with our local, state, and national partners as we work together to respond to this public health emergency. Maryland has entered a new phase in the response to this pandemic called mitigation. Howard County's policy represents a bold decision to slow the transmission of this virus and to protect our vulnerable groups. The Health Department has opened a telephone information line to respond to the many questions and concerns of our residents. In addition to the general public, we continue to provide information and guidance to our private healthcare providers, urgent care centers, businesses, schools, social service agencies, hospital and government partners. We are prepared to assist with expanding testing capability and hospital surge if needed. We are constantly updating our coronavirus webpage with the most up-to-date and accurate information available. And we recently added a section for seniors and those with underlying medical conditions. FAQs, answers to many frequently asked questions, are available in multiple languages so that all have the opportunity to access the information. While so much is unknown about this virus, there are tried and true methods that each of us can do to control the spread and protect ourselves, our loved ones, and our colleagues from getting sick. To help prevent the spread, wash your hands frequently with soap and water or use an alcohol-based sanitizer. Cover your coughs, sneeze into a tissue, throw the tissue away. Don't put your hands to your face. All things we learned in kindergarten. Stay at home when you're sick. Avoid close contact with those who are sick. If you are a senior or someone with an underlying medical condition, speak to your primary care provider. Take precautions to keep space between yourself and others. If you go out in public, keep away from others who may appear sick, but don't stigmatize anyone. Avoid crowds to the extent possible, and avoid attending public gatherings if unnecessary. There will be disruptions to everyday life. Everyone should prepare their household should you need to stay home for a brief or long period of time. Make sure you have an adequate supply of your prescription medicine or other health supplies that you need. Check in with your primary care provider. Have a thermometer in case you develop fever or think you may have fever. Think about a 2-week supply of non-perishable food and water. And have books, games, or movies ready so we can entertain ourselves and get to know families a little bit better because we may be staying home more with them. If there is a silver lining to any of this, it appears that while many of us may get sick, most of us will have mild to moderate disease that can be managed at home. Some may become seriously ill and need to be hospitalized. We want to make sure that those needing hospitalization get the care they need. So, if you are concerned that you or someone in your family may have coronavirus, contact your primary care provider before going to the office. Contact Howard County Health Department Corona Information Line 410-313-6284. Nurses are available to help determine what your next step should be. Always call ahead, never show up in the emergency room. However, if you are having a medical emergency and need to go to the hospital, of course, call 911. We are in this together, we are prepared as a community, and we will manage this emergency. Thank you.
I'd like to bring up other Howard County government officials, and this will be Raul Delerme, Director of Recreation and Parks, followed by Jackie Scott, Director of the Department of Community Resources and Services.
Good morning. My name is Raul Delerme, Director of the Howard County Department of Recreation and Parks. Recreation and Parks has been working very closely with the county administration, county agencies, and the local health department regarding this new policy. The health and wellness of our participants is our top priority. As a result of the Howard County policy and the CDC guidance regarding this rapidly developing COVID-19 situation, effective immediately, we are canceling our large events and gatherings through the month of April. We will also be canceling all our programs, events, classes, and rentals as of midnight tonight through March 29th. In addition, we will close all our indoor facilities while the Howard County schools are closed during the same period. We will then evaluate whether to resume classes and programs on March 30th. All of our parks will remain open. Anyone paid for a now canceled event, program, or tournament will have the option of a full refund or a credit. Please be assured that the Howard County Recreation and Park staff will notify all participants registered for a canceled event or program. We will also update our current registration software and online activity guide so current registrants can see if their programs have been canceled. We will continue to encourage our participants to follow the CDC and local health departments' guidance. Please continue to check our website and social media sites for updates. Thank you.
Good morning. I'm Jackie Scott, the Director of the Department of Community Resources and Services. First and foremost, in addition to echoing what you have already heard, I'd like to ensure the public, our community here in Howard County, that while we know the disruptions that you're going to learn about today that will impact your daily routines of your life, this morning, we'll be talking about those, but please know, while they may be initially uncomfortable, they are temporary, and yet they are very necessary. Our top priority is the safety and well-being of all Howard County residents who rely upon our agency and our government's resources to live healthy lives and to thrive. The decisions we've made are informed by the guidance provided by the World Health Organization, the CDC, and our state and local health departments. Based on that guidance and what we know about COVID-19, our priorities at DCRS are the following 4 key populations at this time: our older adult population, people living with disabilities, those with chronic conditions, and our healthcare and frontline workforce who are working diligently every day to care for our most vulnerable populations and those affected by this current virus. Therefore, to ensure the highest level of care and protection for individuals who depend upon our facilities, our people, and our services, the following changes have been made and implemented at DCRS. Effective immediately, all group programming, events, and activities scheduled for our 50-plus centers are suspended. This includes all exercise classes and programs and all of our social day programs that serve our most vulnerable members and the members with special needs in our facilities. Effective immediately at close of business today, all 50-plus centers will be closed in accordance with the guidance from the governor through the duration of this state of emergency. Our scheduled meal programs will be held at the following centers: the Bain Center, Ellicott City, and our North Laurel Center. We will have box lunches available for people to, using our social distancing, pick up and take with them for the day. We are preparing to have other food access options in addition to that available for our community members who need them, and we will be providing additional notice about those at our DCRS website and on our social media. We will make sure that those who need the food through us and our partners will receive it. For as long as possible, understanding that this is an evolving situation, essential services, though, will remain by appointment for residents who express the need for consultation. These services will be provided to the best degree possible by phone and via web and conference call. Yet, we do understand that there are residents in this community who have limited access to internet and are not able to access services that way. We are therefore working with the health department and with the CDC guidelines to ensure that we are able to provide those services in our locations at our main office at 9830 Patuxent Woods Drive to those who need it. We ask people to call and identify your need, and we will set up services for you. These services for our older adult community include, but are not limited to, our Maryland Access Line that can be accessed at 410-313-1234. Our state health insurance counselors remain available to take calls to assist you with your health insurance. Our ombudsman services remain in full effect to make sure that we are caring for those who need us. And our older adult guardianship program remains fully staffed as we make sure that we are caring for our most vulnerable adults. And for our children and families, we have available for you our care line. Please feel free to call 410-313-CARE, C-A-R-E, or 2273. All home visits and center facility-based visits are suspended at this time for both our older adult population and for our children and families. So please use this number should you need services. All in-person childcare training and certification classes and workshops have been suspended until further notice. But where possible, we are working to provide these classes and to deliver them in web-based online formats for learning modalities so that we can continue to serve this well-needed service for those providing childcare in the community. Finally, let me say, this, we know, is an evolving situation. As we identify other affected programs, we will make the necessary notification. But in conclusion, as I began, I know that this is a lot to digest. We want the community to know that DCRS and our county government partners and our community partners take great pride in the relationships that we have built with you and our members, our neighbors, and our community. And the longevity and trust of those relationships allow our staff to effectively anticipate what some of our residents' most critical needs are. We are here with you. DCRS and our partners stand here today together, ready to help you, ready to serve you. You are not alone in this. We urge you, please do not panic. Use the tools that we are giving to you today and have provided to you previously to make good, clear decisions for you and your families, and don't forget your neighbors. We recognize the stress that this may cause on your daily life. So in addition to your physical health, I ask you to be mindful. Please monitor and care for your emotional and mental well-being. And let us not forget our youngest among us, our children and our young adults. And remember, while things may seem uncomfortable because they are unknown, they are not insurmountable. We are strong and we are resilient as a community. And together, we will get through this. Thank you.
Thank you. And now we'll hear from our Superintendent of Howard County Public School System, Dr. Michael Martirano.
Good morning. My name is Dr. Michael Martirano, the Superintendent of Schools for the Howard County Public School System. First of all, I want to commend our County Executive, Dr. Calvin Ball, for his leadership during this period of time in enhancing communications between all agencies. I also want to commend our outstanding Health Officer, Dr. Maura Rossman, for constant communications with me during this evolving concern of which we have. Yesterday, Maryland Governor Larry Hogan, as many of you know, and State Superintendent of Schools, Dr. Karen Salmon, announced that effective Monday, March 16th through Friday, March 27, all Maryland public schools will be closed for students. This is unprecedented. We have reviewed the order by the State Superintendent regarding the closure and have provided additional information on what this means for our staff and for our community. Schools, as you know, are the nexus for many of our community members, and communications are absolutely essential. The health and safety of our Howard County Public School System students, staff, and community remain our top concern. We have included resources on our website that we want you to use to talk to your children about COVID-19 and related closures. As I have previously shared, I encourage all families to review their emergency plans, including if you need to explore alternative care for your children or arrange to telework with your employer. It is important that families remain at home as much as possible, as social distancing is the primary reason behind the governor and state superintendent's decision. Please, I ask you, bookmark www.hcps.org on your electronic devices, as this entry portal on our homepage for our school system will be used to communicate with our families and communities. Last night, I met with our principals, and again, in another unprecedented action, from 7 to 9 p.m. to discuss next steps. Specifically, the following was transmitted to our principals, to our schools, and then late last night to our community. First and foremost, all school buildings will be closed beginning 6 p.m. this evening, Friday, March 13th, and all field trips for Friday, March 13th today were canceled. All school and central office staff today were reporting to work to make plans for teleworking, and we are sharing expectations as we continue the operations of the school system without our schools being open during the time from March 16th through to the 27th. Further guidance will be given today to our employees regarding telework options and as we keep that business going. Additionally, we have provided guidance about accessing instructional resources, as providing instructional continuity is important during this time. We have provided information to our students with information and instructional resources that can be used optionally while at home, and give them the opportunity today to clean out their lockers and retrieve any personal belongings from schools. A paper version of these documents will also be sent home with our students according to their grade. These resources, however, will not be collected or graded when they get back. We want to put first primary focus on families engaging to be safe first and foremost, and then engaging in the instructional activities without feeling the pressure of graded assignments. In addition, students may continue to work on classroom assignments provided by teachers prior to school closure, but there are no expectations that assignments be turned in during school closure. Food distribution, let me talk heavily about this. Beginning Tuesday, March 17th, we will be providing free grab-and-go nutritious meals to any child under the age of 18 at 4 school sites and 5 mobile sites. Meals will be available weekdays from Tuesday, March 17th to Friday, March 27th, between the hours of 11:30 and 1:30 p.m. And again, all of this information is on our website. The grab-and-go meals will consist of not only lunch, but today we added a breakfast portion of that as well. The school sites for your edification are as follows: Howard High, Oakland Mills Middle, Swansfield Elementary, Lake Elkhorn Middle and Cradle Rock Elementary, and mobile sites: Laurel Woods Elementary Parking Lot, Monarch Mills Apartments, Forest Ridge Apartments, Duckett's Lane Elementary Parking Lot, and Bushy Park Elementary School Parking Lot. We are very concerned about the food and nutrition of our children, our most vulnerable, and remember, our school system has 23% of our young people who qualify for free and reduced meals. It's essential that we provide that continuity of food and instruction during this time, as we are asking for the safety of our families as well. It goes to without saying that when we talk about closing activities, all means all, everything is everything. Plays, concert, SATs, and community school use, as referenced by other partners, all of those have been closed and canceled until further notice. Today, we are treating the school day as the last day of school, where children and young people in our schools have been given the guidance to clear out their lockers and take home any necessary materials that they may need during this 2-week period of time. Additionally, of concern for us are our students who are medically fragile, need for medication and health supplies. We are providing guidance to our parents, and if there are parents listening right now, I ask you to communicate with your parents and your principals in your schools to make certain that you get the medication necessary, because once we shutter our schools today at 6 p.m., there will be no further access to our facilities. I will be providing more information regarding makeup days, and as the concern is some of the statements that were made from our state superintendent last night about spring break. Howard County does have a designated spring break for next month, and I will be meeting with the superintendents later today in a telephonic conference to get further guidance regarding what that means. But I will provide more information about that. More importantly, during this period of time, we recognize why we are closing schools is to prevent the further expansion of this disease, and we're practicing containment, and also recognizing that during this time, we have 77 schools, a total of 81 buildings. We will be doing deep cleaning on all of our buildings, sanitizing our school, and we have teams of individuals who will be deploying on Monday to do so. Once they go through, we will certify that that school has been cleaned as we move through our 80 schools to ensure that when our young people return, as designated now on March 30th, that they will be free of any of the concerns of which we have. I just want to emphasize what my colleagues have said and other partners, that this is an ever-evolving situation. I will continue, as we have from the school system perspective, to communicate with our county executive, with our health officer, as well as with our community on a very regular and transparent basis. Information is shifting in front of us, and I've been asked as well, is that time of reentry in stone? I don't believe that I can say that it is. We just have to wait for further guidance regarding reentry. Thank you very much.
Thank you. Dr. Kate Hetherington, President of Howard Community College, will now provide an update on the college's response.
Good morning, everyone. I'm Kate Hetherington, President of Howard Community College. I first want to begin by thanking County Executive Ball and his team for their guidance and support during this uncertain time. Let me begin by outlining what is happening at Howard Community College. Classes were canceled yesterday and today to prepare faculty for teaching remotely. Offices remain open to serve students. All college-sponsored out-of-state and international travel is suspended for employees and students, including our athletic teams. Spring break will no longer be held April 6th through 12th. Spring break is now March 16th through the 22nd, during which time the college will be closed, while campus access is only for authorized employees. For March 23rd to 29th, both credit and non-credit classes will be canceled. More details about this week for students, faculty, and staff will be forthcoming. All continuing education classes for senior adults will be canceled for 45 days based on the county and CDC guidance. Plans for future public events are still being worked out. I recognize that these actions will impact our students, faculty, staff, and their families. However, I believe these difficult decisions are necessary for the health and safety of the college community. I hope that by acting now, the college will do its part to slow the spread of COVID-19. I greatly appreciate the cooperation, flexibility, and understanding of the entire college community. Thank you.
CEO Tonya Akins will now provide an update on the Howard County Library's response.
Good morning. Tonya Akins, President and CEO, Howard County Library System. I would like to thank Dr. Ball and all of the partners here for the good work in trying to pull this community together in such a short time frame. Howard County Library System considers the health and well-being of our customers and staff certainly our top priority. Out of an abundance of caution in response to the COVID-19 pandemic, and consistent with the CDC's recommendations and Governor Hogan's cancellation of events of 250 persons or more, as well as the CDC's call to practice social distancing in order to slow spread of the virus, Howard County Library System will be closed March 16th through March 27. Customers who currently have materials checked out do not need to concern themselves with returning them. The loan period will be extended through the closure, and fines will be waived. All branches will be open normal hours leading up to the closure. Community members who would like to check out materials prior to closure are welcome to visit any of our locations across the county. Friday and Saturday hours are 10 a.m. to 6 p.m., and Sunday, 1 p.m. to 5 p.m. Due to the recommendations, again, to practice social distancing and cancel large events, we have made the very difficult decision to cancel Battle of the Books. This event draws approximately 1,000 people to each of 6 locations. We know how much students and community members have been looking forward to this event, and we share your disappointment. Due to the number of sites needed for the more than 300 teams, among other factors, rescheduling is not an option. To the 1,500 fifth grade students who were scheduled to participate in this event, we are proud of you. Your diligence in preparing for this academic challenge is not overlooked. We are working with Howard County Public School System to provide a modified Battle of the Books experience at individual schools, should this be possible later in the school year. I am also announcing the postponement of the spelling bee at this time until May 2nd. Again, postponement of the spelling bee until May 2nd, and our thanks to everyone at Scripps for working with us to secure a date. Additional details will be shared via email with contestants and alternates, as well as Bumblebee winners and School Bee coordinators. I encourage community members to explore and use the library's wide variety of e-content, including ebooks and audiobooks, online classes, streaming, movies, and music, and digital subscriptions to leading newspapers and magazines. These resources may be accessed at no cost with your library card and PIN. If you do not yet have a library card, I invite you to apply online to gain immediate access with your temporary number. It's all available 24/7 at hclibrary.org. I will continue to monitor this evolving situation during the 2-week closure. Any additional updates will be posted to our website as well as our social media pages. We in Howard County are an extraordinary community of learners who place a high value on education. Be assured that these decisions I shared with you today were not made lightly. This pandemic calls for drastic measures in order to slow the spread of the virus, and we all must do our part. The incredible Howard County Library System team stand ready and prepared to assist you remotely with the use of our online resources. Additional information on accessing these resources, again, is available on our website. Thank you.
And finally, Dr. Shafiq Ahmed, Chief Medical Director, Howard County General Hospital.
Good morning. My name is Dr. Shafiq Ahmed. I'm the Chief Medical Officer and Vice President of Medical Affairs for Howard County General Hospital. I come before you this morning to reassure you and inform you about all of the preparation that our hospital has been taking quite seriously over the past week to 2 weeks and prior to that as well. And most of our concentration has been on preparing for the event that we eventually will have a patient who is testing positive for COVID. And we are also working on screening patients who are concerned about that at the moment. And so I will echo Dr. Rossman's sentiment about making sure that if you have a need for testing, that you contact your primary care physician or contact the health department and call before arriving, certainly at the hospital. I do want to reassure everyone that we do have a team of specialists that are working around the clock to ensure that we have the resources for patients that need the care the most. And what we've seen with COVID across the world and across the country is that there are patients who definitely will receive this virus and be okay and be able to manage this at home for the most part. But there are also some very vulnerable populations that will be very, very ill from this, and we are ensuring that we have the appropriate methodology to take care of them as well. And I know that you have heard nationally that there are shortages of supplies, and there are things that we are working on. So we've been very proactive with this as part of the Johns Hopkins Health System to ensure that we're judiciously using our equipment to get it to the patients that need it the most. So we are managing that process very well at the same time. We have undertaken the other measures that were mentioned by the governor yesterday in terms of restricting visitors to the hospital, and we have suspended outside classes at this time to ensure the safety of our staff and our patients as well. And we do applaud the effort across all of our partners to ensure that we are managing the community to minimize the spread of the illness, and we are prepared for the instance where we do actually have patients with this disease as well. Thank you.
And now we are going to open it up for questions. Dr. Rossman is going to approach the podium, and I just want to reiterate that there are many other officials as well as leaders who are available for question. I provided that list earlier. And then also, for those who are answering the question, please repeat that question for our audio's sake. Thank you.
Dr. Rossman, in terms of testing, we've heard a lot of concerns about availability of testing, and it's unclear at this point how many tests the state of Maryland does have. Those numbers haven't really been reported. If a case does come to Howard County General Hospital, the hospital of the county, how does that testing process move forward, and who's responsible for that testing matter? Is it the county or is it the state?
So it's a moving target. So up until I'm going to say about, let's just say a week ago, all testing in the state of Maryland was being conducted at the Maryland Department of Health Laboratory. And the throughput at that time was about 40 to 50 specimen patients a day or a week. So, and there were problems we've all heard with the kits initially we got a month or so ago that had to go back. So there were challenges with testing. And the capability to deploy or enhance testing through the Maryland Department of Health, and it's not just Maryland, it's nationwide, there is a gap. The good news is that our universities, both the University of Maryland and Johns Hopkins, are working on developing their own kits that they may be able to, that they will be able to deploy at the university centers. The Maryland Department of Health is working with the CDC on getting more kits as well, and also automatizing their current procedures to at least double the number that they're able to process per week.
So at this point, if there is a case at Howard General, that testing kit would still go to the state health department?
So I didn't finish. So, very recently, our two commercial labs, Quest and LabCorp, have stood up the ability to process specimens. Any provider in the state of Maryland now can collect a specimen from a patient that they think should have COVID testing and can send that specimen either to LabCorp or Quest. I think it was alluded to that there are problems with PPE so that our providers can safely collect that specimen, and we're working on a state level as well as federal level on getting strategic national stockpile release so that we can get the proper PPE. So right now, if a specimen is collected on a resident, which doesn't have to just be Howard County General, since one can go to a number of hospitals, that information, if it is approved by the Maryland Department of Health, that information goes to MDH. If a provider, and there are a few providers now collecting specimens, our private providers collect the specimen and send it either to LabCorp or Quest, that information does not come to the local health department or MDH unless it is a positive. So I think you started your question, how many tests are being done, and it's impossible to know at this point because the tests are being done in a variety of different places, and we're really only concentrating on the positives.
Dr. Rossman, you began your remarks by saying there are 15 confirmed cases in Maryland, which is news to me. Can you explain what these other 3 positive cases are?
I don't have that information. I'm on a statewide call every morning, and it was reported that there were 15 cases, or at least that's what I heard on the phone call. I did ask about the cases, and I was unable to get any information. So I apologize for that, but that's the best information that I have at this time.
Can I just follow up? I didn't know if you wanted to clarify. Since 5 o'clock this morning, I've probably talked to 100 people in my travels, a lot of parents scrambling, what do I do with my kids, sending their kids with empty plastic bags, clean out their desks today. And a lot of people are wondering, is it okay, I'm going to be home teleworking with my kids. Should I keep them away from their friends? Can we have play groups? Will playgrounds be disinfected? Is there advice for, I know that's not an at-risk population, but does the social distancing extend to kids as well? Or are you discouraging parents using that, playtime as a way to keep their kids occupied?
So I wish I had all the answers. As I think many of us mentioned, our lives in general have now been disrupted. And to the extent possible, we need to have the information at hand to make the best decisions possible. So again, the good news is, or it's not good news, it's just a fact that children don't seem to get as sick from this virus. So does that mean it's okay then to mix up our kids? I'm not so sure I'm able to say, yes, go forth and have your play groups or develop your own daycare system. I think that's a choice individually that parents need to make based on their family makeup. Who's at home? If there's a grandparent or someone at home with a medical condition, you may want to consider having your children participate in group settings. So that's why we are concentrated on pushing out the information that we can so that people can begin making the decisions based on their particular considerations.
Dr. Rossman, so about the 15, I just needed some clarification on that. Did that information come from a health department official on that conference call?
Yes.
Okay, and so were you the only one who asked if it was 15 and they didn't, they kind of said?
It was a call out, so it was a conference call where we are listening and receiving information. So
that's when you asked if it was definitely 15, they stood by that number?
I didn't ask at the conference call, and I'm not really trying, I am certainly not trying to not answer the question. So it's a participatory conference call while I am listening in. It's not a Q&A session. Later, after the phone call, I did ask my contact if there was additional information at this time, and I was told no. So I may have misheard, or it may have been misheard, but I've not been able to verify that.
The statewide, was it a regular, I know everyone's been talking regularly, superintendents, was it like a?
It's a regular statewide call that I participate in.
I have another question about the hospitals and your preparation for this. Can you kind of give us an idea of what are some of the steps that you're taking? We've seen where tents are being erected at certain hospitals. Is that the case for you guys? And are you truly ready to separate folks if someone actually comes in and they're ill?
So that's a great question, and I think we do actually have a tent up. We have not operationalized it. We are keeping it in place for in the event that we may need to do other things with it, and we're working on plans for potentially screening. So that is the one reason that we have a tent up. I think to answer your other question about, can we actually separate patients, the answer would be yes. And that's really what the preparation has been about where would we manage these patients and, who would take care of them best, how do we get that care to them and make sure that we get their care done appropriately within our setting. As a health system, we do have a plan for managing patients at Johns Hopkins Hospital that are tested positive for this as well. So we do have a few layers that we're in planning for where to get the best care for them as well. So yes.
Can you elaborate on that? If someone comes in and they're sick, what can they expect to see once they get into that tent and then beyond that point?
So right now, I just want to qualify, we are not using the tent for that portion of it. We are using the emergency department. So the management of this disease right now is still the management for patients with acute respiratory distress. And the way that we are managing that is that if they need to be intubated or go to an ICU level of care, they would be transported to our ICU. So that would be for people who are the sickest. And for people who are coming in and having other symptoms, they are tested for other diseases, and if they can be managed at home, they can go home. If they can be managed in the hospital at a lesser degree than intensive care, then they can be managed that way as well. If we do need to isolate them, then that's part of the planning. Within our hospital, we have different areas and what we call negative pressure rooms to make sure that we safely manage those patients.
I have a question that almost every agency had, I hope can answer. So I know Dr. Barteron used to, guidance is coming later for school staff, staff, keeping the systems going. If the schools are closed, the libraries are closed, the rec centers are closed, before and after care is closed, lunch aides aren't working, bus drivers aren't working, are they still gonna get paid? Could they be reassigned to other jobs? You know, the bus driver can't telework, but maybe a pre-K aide can. So, and I had a lot of people asking me this morning. They haven't heard anything. Do I have to find a temporary job for the next 2 weeks? There's thousands of people who are across all of these.
So understand, we have close to 8,000 employees in the Howard County Public School System. Each one of them falls in a different classification because we are a unionized group of individuals, and each one of those groups has a different obligation based upon their contract. And so right now, this morning, in terms of the interpretation of this, we are communicating with our staff right now about, first and foremost, today we are shuttering our schools and closing down our system for all intents and purposes. But business does have to occur, the essential functions. So every individual in our school system should be asking, what do I do on Monday morning, and what does life look like for me as someone who just was teaching today, what happens to me on Monday? As I stated, each one of those individuals has a different group in terms of how they qualify for pay and payroll. And there are individuals within our system who are hourly, who don't get paid based upon the fact that they provide a service and they get paid based on that. We are delineating all of that, communicating with the different groups. That is occurring right now as this ever-evolving situation. There is great concern of continuity of pay and break in pay, and we're doing everything that we can to ensure the communications are there. And making certain that our operations allow people to get paid on the next payday.
So if there isn't, you don't have the answer right now, is that?
The answer for all the individuals who fall in certain classifications, they know where they fall. Individuals who are defined as hourly employee or part-time employees, temporary employees, there's a different classification for them, and we have to communicate differently to them. And I will communicate that out to the community once we have that firmly defined.
What about in the Department of Rec and Parks, you provide a lot of services in schools? What about those teachers, those who might work at the facilities, facilities that are being closed?
We're actually in the same process as the school system. We're evaluating that situation now with administration as well as our department to see how that will work. So, same situation.
And the libraries, I mean, there's a lot of, do people take another job? When will they know where to show up Monday?
Yeah, great question. So I can take this opportunity to thank our Board of Trustees in wrestling with all of these questions over the last couple of weeks and certainly in the last few days. We, both our regular full-time and part-time employees, will be paid during the closure. Our staff, as stated earlier, will be working remotely to assist customers with our online resources. Our instructors will continue to prepare curriculum and prepare for when we reopen. So a lot of that work is still ongoing. Our communication staff certainly working remotely during this time to, again, keep updating the community with where we are with additional resources as we move through this challenge. So for our team, thankfully, we're in the good fortune of having a lot of the electronic resources that we needed because we provide them to the community, laptops and such like that we use for our classes to be able to deploy to our staff.
I just wanted to ask you guys, many people are wondering about church on Sunday or Saturday. What's your advice to folks who are wondering, do I go to church or not?
So we've given our recommendations on large gatherings, and I think we're already starting to see some churches who are going to online services or who are actually canceling. And I think that they are going to have to evaluate, for example, there are some churches that are just very small, have a very small congregation. But we would strongly recommend that they adhere to our large gathering policy, which would suggest that they do not have those services if they are large at this time.
Dr. Rossman, as of Wednesday, the state had said that there were 90 individuals tested for COVID-19. We said at that point they weren't going to release how many tests were pending and whatnot. Has it been indicated to you how many of those 90 tests were of Howard County residents? Are you getting that kind of information updated on a daily basis of who's being tested, not just who's testing positive?
So I can tell you the Howard County Health Department has approved testing for less than a dozen Howard County residents. Testing could have been approved from another source if they went to a different hospital, but that's my best information right now.
Any positive tests taken here? Someone even live here?
No, not as far as I know.
Okay, well, we thank you very much for coming, and I also want to convey, as you can see, Howard County is working collaboratively and vigilantly through this. We thank you. If you have additional questions, all of our community members, leaders, and officials are here right now at our conclusion. Thank you.